My presentation is over social isolation and suicide within nursing homes. My hook. What happens when the place meant to care for somebody turns into the place where they feel the most alone? The question that helped me guide my research would be, should government policymakers require nursing homes to implement structured social engagement policies to reduce isolation-related disease and mental health decline among residents? The connection I had to stimulus, first of all, the stimulus I used was our epidemic of loneliness and isolation, which is stimulus number 2. The connection I made here is evidence shown in the article. Social connection is essential to physical and mental health, and loneliness increases the risk of poor health outcomes. Now, we see here on this graph, lacking social connection is as bad, if not worse, to smoking 15 cigarettes a day. My thesis is, should the CMS, which is the Centers for Medicare and Medicaid, should they require structured engagement programs, encourage family involvement, and raise the wages of staff that work in nursing homes in order to reduce isolation, depression, and suicide among the elderly? My first reason, isolation to depression, demonstrated from Teskey et al., limited social interaction leads to loneliness, a loss of emotional support and sense of purpose. And within nursing homes, it's actually very difficult to form meaningful relationships, since most of them it's probably likely that they have some sort of cognitive decline, and it's hard to just form those bonds. There are also high rates of depression among residents. That is further amplified in this graph that I made here. It shows that all nursing home residents, which is somewhere in the 1,250,000 range, out of all of those residents, 30% of them suffer some form of depression, being around the 375,000 range. And that was from nursing homes abuse. My second reason from depression to suicide is that depression significantly increases the risk of suicide. Elderly individuals have a higher suicide rate just in general, not only in nursing homes, but specifically in nursing homes. Isolation worsens mental health conditions, so there's a cycle that contributes to that. So your isolation is pouring back into your mental health decline, and you get depressed, and then that can lead to suicide, ultimately. Suicide in nursing homes is often very unreported. There's very little data on these suicides. We know they're happening, but there's neglect when it comes to reporting those. Treatment issues. So in a different light, there are some other issues contributing to why there's depression in nursing homes. Antidepressants, the things that are supposed to be helping you, or more specifically SSRIs, which are something serotonin reuptake inhibitors, I don't remember the first one, have side effects. They have major side effects, such as withdrawal, like if a person with dementia forgets to take their medicine, which is very likely, they can have really bad symptoms, and that can pour into the cycle of depression, and that leads down the road of suicide. So while the medication is trying to fix it, it doesn't necessarily fix the isolation. So my refutation, many people would probably say that nursing homes are well off right now because of the NHRA, which is the Nursing Home Reform Act of 1987. So before then, nursing homes were way worse than they are now. So it is a blessing that they have been able to come together and make that policy, the CMS. However, it's more like it set goals for physical things. Like there's less restraint now, there's less neglect, there's more documentation of neglect and firing, and on that sort of note. But where it fails is really kind of in the mental health department, and really ensuring that those goals are met, ensuring that there are people going into nursing homes and doing, blind, I'm forgetting the word, blind reviews of the nursing homes. However, there are limitations. Staffing shortages are very rampant throughout most nursing homes in America. There is the issue of low wages, which I mentioned before. They get paid, the median pay for nursing home nurses is it's a good bit lower than the median for the overall workforce, which is everyone in any type of job. So that increases burnout and a high turnover rate. So there's constantly nurses filtering in and out of nursing homes. So there's not actually someone that they can make a bond with. Like the residents, they can't make a bond with their caregiver. And there's a lacking of motivation when it comes to caring for these old people and making sure they're not neglecting the old people because they're not being paid very much. And they're also having to spread out their services among multiple different patients. So, you know, there's less attention to one nurse or one resident, so to speak. Right, and like I said earlier, suicide and mental health are usually going unreported. That's all by these. Harvard Health, I forgot to mention that. Harvard Health is where I got my treatment issues from. So this graph is how I got my information for the workforce in nursing homes. They have significantly less retirement access than the normal workforce. They have less health insurance. They're working more jobs on average than the average person in the workforce, and they have significantly less union coverage. That comes from the state of residential long-term care industry. So in conclusion, social isolation is a major contributor to depression and suicide in nursing homes. Current policies address those physical needs, but they don't address the mental needs, and they're not being enforced properly. Structured engagement programs would create that consistent social engagement that they need. Family involvement also adds to that social engagement that they need, but from people that they love the most. Despite these limitations, the impact of not doing anything would be far greater than actually implementing them. Social connection should be the #1 priority for nursing home residents that are obviously going through some sort of mental health decline that is affecting the depression rate. That concludes my presentation. Thank you. These are my sources.
Thank you.
Yes, ma'am. Would you like for me to stop the timer?
You can leave it, it's okay. So a couple of follow-up questions. Did your research go in a different direction than you originally expected?
It did not. I knew from the start what I wanted to go with, and it did. My research question did kind of develop when I was going into more specific things. Like instead of at the beginning, my research question said government policymakers. Then my thesis said the Centers for Medicare and Medicaid. So it was only like the refinement of what I was researching, not really changing what I was researching.
Thank you. And final question. What are the implications of the findings that you discovered regarding this issue? What are the implications in your own community?
Okay, so I have experienced significant tells that this is a big issue in our society. My stepdad's mother-in-law has been kicked out of like 5 nursing homes because they're not operating them correctly. They don't know how to give the service properly. The other day I saw a woman on the side of the road who I figured had some sort of mental health issue, and her husband was following her on the road. So there's implications everywhere that this is an issue, and the implication of solving this issue would mean that would stop, that there would be less depression in nursing homes. Specifically where I live, I don't know if this is such a rampant thing like that I see on an everyday basis like I do everywhere in America, but specifically here, that would really solve a lot of issues.
Thank you for sharing.
Yes, ma'am.